Assalamu alaikum wa rahmatullahi wa barakatuh, dear father. I am 50 and I have diabetes, and it drops suddenly, and therefore I cannot use insulin because it can affect me to fall in clinical death. So I use some medicines, but I don't earn enough money to buy all medicines, and it is difficult for me to carry this illness. Is there any cheaper and natural cure for it? AROPL Al-Mahdi, Azerbaijan.
Hello, welcome to the Medicine of the Mahdis. So our first question comes from brother Arif Kuliev from Azerbaijan. And he has diabetes mellitus, diabetes for which he takes insulin. So let's talk a bit about diabetes mellitus. Now, if you're on insulin, this is a fairly advanced form of the condition because diabetes can be treated simply by changing your lifestyle measures. Then there's tablets, and at the third tier, at the very top, is taking insulin. So if you're taking insulin, you obviously have had diabetes for a while. What is diabetes? Diabetes is basically when there is too much sugar in your blood. Too much sugar in your blood causes your blood vessels to become narrow and sticky and inflamed. And this can cause problems all over the body. So anywhere from your eyes, where it can cause blindness, it can cause strokes, it can cause ulcers in your feet, it can cause gangrene in your legs, it can cause kidney failure, and it can cause heart disease. So it really is a head-to-toe illness because our blood vessels run all over the body. Anywhere where there is a blood vessel that is closed, you're going to have problems. Diabetes is of two types. So firstly, brother, we need to know if you have type 1 diabetes or type 2 diabetes. Type 1 diabetes is the type of diabetes you get diagnosed with as a child, usually before the age of 30. And oftentimes, as a sick child goes into hospital, they check the urine of the child and the blood, and they can see sugar is very high in both. And this usually gives the diagnosis. And this happens when there is not enough insulin produced by a gland that sits at the top of your stomach here, just underneath, and it runs back and it produces insulin. It's called the pancreas. This type of diabetes requires insulin no matter what because the body doesn't produce its own insulin. And this accounts for 10% of all cases of diabetes. Now the other type 2 diabetes, makes up 90% of the type of diabetes we see. And this is usually diagnosed by age 40 or afterwards. And it is caused by the fact that you produce insulin, but the insulin that's produced by your pancreas doesn't work. And this is more caused by the lifestyle measures that you have. So, for example, eating too many refined sugars, which is really at the heart of the cause of diabetes. Diabetes is a condition where carbohydrates are not metabolized effectively, meaning your body doesn't process it well. Carbohydrates are simply larger molecules made from sugars. So anything that is made from sugars at its highest level, at its biggest level, is called a carbohydrate. And in diabetes, you cannot manage this well, and so your blood sugars go high. So now that we have a general understanding of what a serious condition diabetes is, it can slowly cause clogs all over your body, resulting in many types of illnesses. In fact, diabetes has its own speciality within medicine called diabetology, where a diabetic doctor works with a few nurses to manage the head-to-toe symptoms that you can get. It's a very quickly increasing medical problem. So, for example, in the early 80s, we had just under 100 million people with diabetes. Today, we have almost 500 million people. It's a problem that is increasing very quickly in the developed world as well as the developing world. So Brother Arif, you mentioned a very specific problem. You said that you are having these experiences where you're losing consciousness, you're actually fainting. And this is a very well-known side effect in patients who take insulin. And if you are getting these attacks, which we call hypoattacks, hypoglycemic attacks, meaning when your sugar falls so low that your brain can no longer function, and you fall and you faint and you go unconscious. This is a serious side effect of taking insulin. And if this is happening frequently or regularly, it's extremely important to look at the type of insulin you're taking. There are basically 5 types of insulin, and all of them work differently. Some are fast acting, some are short acting, and some are long acting. And some are a combination of all of those. So if you're getting lots of these hypo attacks where you're fainting and losing consciousness, we need to look at the type of insulin you're taking. And maybe if you have type 2 diabetes, you may not even need insulin at all. Maybe your condition can be managed just with medicines, with tablets. One of the things I would love to know is what type of diabetes you have, what age you were diagnosed at, because that changes how we can manage the situation. But if you're currently taking insulin, let us know the type of insulin you're taking, and then we can advise on how to mix and match accordingly to manage your diabetes. You mentioned that unfortunately you do not have the money to buy the medicines you need. This is a big problem, and this is something we're willing to help with. If you can tell us which medicines you are unable to afford that your doctor has prescribed, we at the Ahmadi Religion of Peace and Light would be more than happy to help you. If you write to us with the names of the medicines, inshallah, God willing, we will assist you in making sure that you can get the medicines that you need. The final part of your question is a really interesting one, and it's the one that most people want to know the answer to, which is there a natural cure to diabetes? So, diabetes can be cured, and we know this, and even the worst type of diabetes can be cured. We know this how? There is a type of stomach surgery that you can get done, and it's called bariatric surgery, where you cut a big portion of the stomach out and you tie the tubes connecting the top of your stomach to your intestines. This type of surgery, after 2 years, has taken diabetics on insulin off every single one of their medicines. Now, I'm not suggesting that you go out and get the stomach surgery unless you are extremely overweight. But my point is that through careful dietary restrictions, you can actually reverse even insulin-dependent diabetes mellitus. And if you think about it, even the Imam Ahmad al-Hassan and Abbas Sadiq have both said that there are certain advances made in Western medicine that are actually very good in the management of certain conditions. When you come to diabetes, which the vast majority of it can be reversed because it is a lifestyle condition. Yes, there is a genetic component in it, meaning if your father, mother, brother or sister had diabetes, you're more likely to have it as well. But you can actually really reverse things by changing your diet, by taking the refined sugars out and eating foods that break down sugars more slowly and having more healthy fats in your diet, as well as proteins. I don't want to get into a large talk about the dietary changes, but there are lots of resources online, and I will put one along with this video to help explain to patients how they can manage their diet to better control their diabetes and their blood sugar. Natural cures for conditions like diabetes are exercise. Any type of diabetes with regular 20 to 30 minutes, 3 to 4 times a week has been shown to actually increase the effectiveness of your insulin. So if you're exercising through resistance training, meaning using small weights and aerobic exercises in high intensity, remember, you have to do what you can manage. This is something you have to discuss with your doctor before you get into any kind of physical exercise routine, but exercise is proven at all levels to help with diabetes mellitus. I've mentioned the diet aspect of it, and now let's come to the cure. If you do not have a certain type of hormone in your body, in this case insulin, what is the cure? The cure is to give insulin. If you don't produce enough of your own, you take insulin. If you have insulin, but it's the wrong kind of insulin, you can take medicines safely to manage this condition. And diabetes has been proven to be reversible, and it can be reversed. It takes dietary discipline, regular exercise, and stress management. I will put links to this video to very useful websites which give further information. But Brother Arif, thank you very much for your question. And if you could provide us with the specific details that I've asked for, the type of insulin you're taking and the medicines you need but you can't afford, we can help you out further. Thank you very much.